All right. Well, could Pfizer be heading for bankruptcy? Is that writing on the wall? Now, you may think, oh, no, they did so well during the pandemic. They have so much immunity. This is not an inevitability. Well, let's take a look further at what's been happening with Pfizer, because, yes, it sounds dramatic. But look at the company's financials. Pfizer just announced that they will have to conduct layoffs next year in 2024 and cut more than $3 billion in costs. Now, Pfizer is estimating this year their annual profit will be somewhere between $58 and $61 billion. Now, previous forecasts were between 67 and 70 billion. So that is by many order of magnitudes smaller than they intended. Now, you may say, well, I don't feel sorry for anybody with $60 billion, but consider that last year Pfizer made over $100 billion, mostly due to the COVID vaccine and the government's purchase of Paxlovid as a treatment for COVID. Now, let's take a look at Pfizer's stock for the last 5 years. So let's say that the pandemic and the vaccine rollout happened at this first major dip. Do you see that in 2020? Big dip in Pfizer's stock. And then, oh, look, there's a vaccine, and it goes up and up and up, right? But look at where we are now. We're almost to pre-pandemic levels with Pfizer's stock price. But Pfizer is the media darling that saved us from the pandemic, if you were to believe the media, right? Pfizer ended the pandemic. How could they be in trouble? Well, here is Pfizer CEO Albert Bourla just this week responding to this revenue drop in a revenue call. He said, we are in the middle of the COVID fatigue. The COVID fatigue. Nobody wants to speak about COVID. Correct. He says,
how can they come up with a new name for it? This is
right.
they're going to come up with a new name, a new branding, right?
Yes, he says we have the big anti-vaccination rhetoric. Okay. I mean, if a company has really good customer retention, right, you don't have that kind of backlash. If you delivered a product that people trusted you and believed in, maybe we wouldn't have the big COVID fatigue. Go ahead.
Maybe they shouldn't have paid out such big bonuses to the executives. Like they could have put that in savings or something.
Yes, true. That's a good point.
It was 100% profit because we did all the research.
Or all of the extra billions they got from like the European Union, right? That just funneled all this extra cash to these guys. Couldn't they have put that like in a rainy day fund? A bankruptcy fund?
Surely.
I saw someone in the chat just said they want to burn the paperwork. Someone on our Rumble chat just said that's what they want.
They do.
They want to burn all the paperwork in a bankruptcy filing.
I hadn't thought of that. Yeah, a bankruptcy filing.
Wouldn't that exactly do that? It would enable you to get off the hook from
well, they could maybe declare bankruptcy from some litigation,
right?
Possibly,
right. Especially if in discovery, exactly.
Right, but that doesn't mean that you can destroy.
It's a metaphorical. It's a metaphorical protection, right?
Right, but we saw Johnson & Johnson was able to take certain IP and move it to a different LLC when they were sued over, I think it was talc.
Baby powder.
And baby powder, right.
They were able, they basically spun off their baby powder division so that could get sued and file bankruptcy, and then they kept their other stuff.
Right, and so they only had one division that got sued into oblivion, and the rest, and then they were just fine. So this is absolutely something that Pfizer could do.
Could you imagine if we did something like that? Like, hey, the government's going to come in and take your money. I'm just going to start another bank account and hide it over there. We'd be jailed. And
but you can do that if you're Pfizer. You can do that if they're one of these big companies.
Right.
Yeah.
Now, in August, before the vaccine rollout for this most recent booster, which was not clinical trial at all, we covered this recently. You should look at the documents yourself. The FDA approved the new COVID vaccine based on models from the original COVID vaccine, just modeling. That's it, estimation. They did not look at any tests of the one that is being given right now. No clinical trials. Watch that segment back if you don't believe me. Anyway, I digress. In August, Bourla said that Pfizer was hoping for 25% of the U.S. population to get the COVID booster. Now, that may seem pretty reasonable considering that about 80% of the American population took the original COVID vaccine. So if you think about attrition, 25%, okay, that's probably doable, right? How'd they come up with that? Well, they thought 50% of the American population takes the flu vaccine. And it's kind of, can we catch them when they come in for their COVID vaccine? Watch how he says this. He says, if 50% get a flu shot, can we get 50% of that 50%, and then we've got 25%, and then we're doing okay. Watch.
But right now we know that in most likely, starting from September and all the end to the vaccination season, 50% of Americans will go to get a flu vaccine.
Right.
The question is how many of them will get also a COVID vaccine. If half of them get a COVID vaccine, the projections likely will be a little bit higher than what we predicted.
Okay.
But if 5% of them get a vaccine, clearly the projections will be lower.
Okay.
Whatever will be though, this year, I think, is a very safe predictor of what will be the years to come.
Right.
Oh.
Okay, they're not getting anywhere near 25%. Right now, the CDC is estimating that about 2% of the American population has got the most recent COVID booster.
2%, yeah.
2%.
And I think we're winning, don't you? I mean, like, I think getting this message out about this stuff, like...
Well, I mean, I don't like that term winning as if we have an agenda. If the vaccine were awesome...
Well, I have an agenda. It's education.
Right.
So, you know, when we educate people and they make a decision that's not propaganda and not mainstream media propaganda, being shills for the CDC, taking U.S. taxpayer dollars and putting it on television and telling you what to go do with your body. So I do have an agenda when it comes to that. Go ahead, David.
Well, I was going to say, like, just listen to the way these companies talk. It's like there's no worry about people actually getting the flu or actually getting COVID. It's all about we need this percentage of people to get these shots. So we got to do marketing campaigns to get these needles in people's arms. Otherwise, we might go bankrupt. But it's not like because we care that the flu goes away or we care that you don't get COVID. It's so that we can make profits.
Right. Bottom line, profits. Yes.
Right.
Money, money, money.
But still, you know, saying that like we are fighting against Pfizer, we're not. We're just presenting you information that shows that Pfizer has not given it to us straight. They did not properly clinically test any of the COVID vaccines. They lied to us about which one they were giving, and they overestimated the effectiveness of that vaccine. Now, you may say, oh, but, you know, the vaccine saved lives. We've discussed this. That data doesn't exist. I've looked for it. The data that the CDC uses as a metric of success for post-vaccination is only that people who were vaccinated were less likely to go on ventilators. That's it. They can't prove a reduction in deaths. They cannot prove a reduction in transmission. We've looked for that data. It doesn't exist. So now when we're looking at Pfizer only being able to give this booster to 2% of the population, 2% of the population is not getting the Pfizer vaccine because they have to share that 2% with Moderna and Novavax. So they can't even guarantee a 1% share of people getting the COVID vaccine. So, okay, but do we feel sorry about that they're not able to sell it? Not really, because the American taxpayer is still buying it, given that it was put in the vaccine schedule. They're still making money. They're just not making as much because not as much order. Same thing with Paxlovid, that's just not being ordered. But is it just that sales are down, or is there more trouble for Pfizer? Well, recently, British Member of Parliament Andrew Bridgen sent a letter to Prime Minister Rishi Sunak letting him know that he had evidence that Pfizer did not deliver the vaccine that they delivered clinical trial information about. In fact, he says that Pfizer originally rolled out the vaccine in 2020, showed the FDA clinical trial data, and then delivered a different vaccine. This is something that, if you watch John Campbell's YouTube channel, he talked about how when he realized that he had been analyzing all of this vaccine trial data for his channel and giving his audience an assessment of that vaccine data, and then realizing that he sort of sent them out to get a different vaccine because he thought that those that data was promising. He was really upset about the fact that, like, I was telling somebody something that was wrong and I didn't know it. Watch what MP Andrew Bridgen says about this.
On the 7th of August this year, I wrote to Prime Minister Rishi Sunak with evidence that I'd received from Dr. Josh Guchko of the Hebrew University of Jerusalem, which indicated that Pfizer had been enabled by the MHRA, the Medicines and Healthcare Product Regulatory Agency in the UK, to carry out a bait and switch operation with their vaccine, which meant that the Pfizer vaccine that was tested on 22,000 individuals with 22,000 in a placebo group was not the same vaccine that was rolled out in the UK and around the world. The compelling evidence for this is the fact that on the second day of mass vaccination in the UK, the MHRA changed the guidelines, told people they had to stay at the vaccination centre for 15 minutes after vaccination. The reason for this remaining at the vaccination centre was the risk of anaphylactic shock. The MHRA hadn't expected anaphylactic shock because it wasn't shown in the Pfizer trials. You only get anaphylactic shock when there are endotoxins in the vaccines. You only get endotoxins in the vaccines when they've been cultured up in bacteria such as Escherichia coli. That demonstrated that the vaccine that was rolled out around the world was not manufactured in the same way or to the same standards as that vaccine that they'd got medical approval for. That means that nobody could have given informed consent. They were told that the vaccines were safe, effective and tested, and what they were taking was a completely untested vaccine from Pfizer. I'm still waiting for the Prime Minister to respond to the 44 pages of evidence I supplied on this matter, which is of crucial importance to the health and well-being of our nation.
All right, well, he's going to keep waiting because nobody seems to really be interested in that right now. We are. I'm glad you are. You're here with me. But Pfizer has immunity, right? That's what most of us have been throwing our hands up like, well, they can't be punished for that. That has sort of been the big story, that no matter what happens, Pfizer was given rock solid immunity by most governments. But maybe not, because some people online are starting to talk about how the PrEP Act that the government put in place to protect the vaccine makers will not hold if Pfizer is found guilty of fraud. Well, how do we know that the FDA perhaps... how do we know that the question is, how do we know that Big Pharma can be held liable if they are found guilty of fraud? We know because that's what happened to Purdue Pharma when they tested OxyContin and were sued into oblivion for causing the opioid epidemic. Now, here is something, I've shown you this before, but I think it's worth looking at again, at just how much the FDA is in bed with Big Pharma. Because from research from the book Dope Sick, which then later became a miniseries with, I think it's a Hulu show with Michael Keaton. I believe. But it's a fantastic book, worth reading. But she tells the story that it came to light in the last 10 years that FDA regulators and Big Pharma executives have been quietly holding private meetings at expensive hotels, at least annually since 2002, through a drug industry-funded nonprofit. This came from the Milwaukee Journey Sentinel. Now, the meeting led to the development of enriched enrollment, an aptly named practice that allowed drug companies to weed out people from their studies who didn't respond well to their drugs, therefore tipping the balance towards FDA approval of new drugs and away from science. So Purdue and others were caught working with the FDA to manipulate their trials so that their drugs could pass. Now, I think what's interesting about this and what I think about a lot is that when you talk to someone who is all in on the COVID vaccine and really wants to believe that that was a great thing to have done, the COVID vaccine, and you say, well, there was a lot of unethical practices around the development and delivery around that vaccine. They say, oh, no, that's not true at all. And then you ask them, well, do you believe that the drug companies and the FDA started the opioid crisis with unethical practice? Yes, most people believe that. They believe that opioids were a scam, that it was created to addict people for profit. So I don't understand why it's relatively accepted that biopharmaceutical complex created the opioid crisis, but then we cannot question the COVID pandemic. Have you seen those two narratives, and does that cause you any pause like it does to me? Now, it's worth noting here that the Big Pharma is not acting alone. The FDA is allowing this. So even if Pfizer is held to account for delivering a different vaccine, for not giving us the full weight of the clinical trials, for perhaps manipulating the clinical trials by removing people like through this, enriched enrollment. Even if that's the case and Pfizer goes down, the FDA doesn't go down with them, right? So we're stuck with these same practices unless we make demands for better clinical trials, more ethical practices of drug companies, and a better FDA, basically. Because given that Purdue was sued into bankruptcy because of malpractice, while the FDA got off scot-free, could that be predictive for Pfizer? Now, I have a lot more to say about this, but I'll just wrap it up with this because I did just finish the book Turtles All the Way Down about vaccine science and myths. That book will blow your mind. It will blow your mind about just how much of a sham is presented to us when it comes time for vaccine and pharmaceutical trials. They do not give us the full story. I know you're shocked, but there are things that we can do because even if the rug is pulled out from under Pfizer or Moderna or Novavax, or Johnson & Johnson, we still will be stuck with the same system. So what we should do, this is just what I've been thinking about based on reading this book and based on looking at this style, is that we absolutely should demand, here I made a list. These are some of the things we can do, even if Pfizer goes down. Demand the requirement for true placebo trials of all new pharmaceuticals and demand that that be law. Demand standardized clinical trial parameters so that you cannot throw out people who respond negatively to the drugs. Eliminate emergency use authorization. Require mandatory adverse events reporting, such as the VAERS. For right now, only pharmaceutical companies have to report adverse events, not hospitals, not doctors, even though they do have to report infectious diseases. This should be standardized reporting so that we can take care of people who get hurt. We absolutely should demand extensive research of the current vaccine schedule for children. And we should repeal vaccine requirements for non-herd immunity inducing vaccines. For instance, tetanus doesn't offer herd immunity. It makes no difference if I'm vaccinated for tetanus and Clayton is not. That's not a herd immunity because that vaccine only stops your body from responding to tetanus. It's not an infectious disease. So there should not be requirements for things that do not induce herd immunity. So that's a short list. We're going to keep going over this because I'm on fire about this book. Let us know what you think about whether or not Pfizer could actually be held, what's the expression, have their feet held to the fire through this information.
Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern Time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.